Sorry.
Let me briefly break in as a non-healthcare expert, but a cross-sector expert, because if global health policy is simply about shipping some generics and vaccines and simply deploying European medical model to Africa and Asia, I believe we are completely on the wrong track. And I give you two maybe pillars and principles for global governments. Firstly, aligning at least 4 or 5 different policies: healthcare, environmental policy, and 2 other policies. Sorry, I forgot them here. Education and energy policy, because it just came from the energy workshop. Okay, Professor Yunus of Bangladesh, he was in Vienna 4 weeks ago, and at the social business conferences, he showed how the interlinkage functions. So if you empower the people to change the job status, also the healthcare status is changing. So these 4 sectors, I believe, have to be aligned. Secondly, which is much more important, I believe global governance means local empowerment. They have thousands of years of experience of local medicine, of local substances, of local herbs, of local expertise, whatever, and you can simply help them deploy it instead of shipping some generics or vaccines around the world. Sorry, I mean, this is, in my mind, really an old-fashioned strategy. I mean, we know exactly that in Latin America, in Africa, even in Europe, we have an ongoing tradition for thousands of years. And what we currently do in Europe is to exploit all these local heritage. I mean, in Germany, in Austria, and other countries, we even go for Chinese medicine, we go for Indian medicine, whatever. We are currently shifting away from this traditional way of healthcare policies.
That does not mean that they are efficient.
Yes, they are efficient. This is efficient.
Bullshit.
And I mean, it empowers the local people in these countries instead of deploying European policies. I mean, I'm really surprised. I mean, ask Professor Yunus, attend his conference, and you can easily see how this works in India, in Bangladesh, even in Africa now. In a cheap way. We don't need the billions, whatever, of funds to deploy it.
Well, okay, I think that, I mean, not to go too far, I mean, if you think about tuberculosis, or, I mean, or, you know, of polio, I mean, typical cases where eradication comes from vaccine.
Point, and we said it probably when you were not there. We said that obviously you have to have a social system which enables people to solve at the same time the question of environment, food security, education, and health. So with that, we agree. To your point about the efficiency of traditional medicine, you know, I've been studying that for 40 years, and there's absolutely no evidence. There's some debate about acupuncture, but the rest, you know, homeopathy is a laugh, and all the rest, you know. So you have some rebouteux in France, so when you have bones displaced, and you're okay, and you can pray God, because we know that. How do you call that? You have a placebo effect. So, you know, placebo cure. Even if it is bread with a bit of sugar, if you say it's the most efficient, latest, late from industry, 80% of the case. But, you know, there's a word debate, and this issue is reasonably well known. And you know, even in China, when you push them about, you know, what they call traditional medicine, they know that, you know, there's not much behind that. Okay, and I think it's a bit, I don't know the English term, condescendant to, you know, about, comment? Thank you. To say that. I agree with your first point, but the second really is, you know, the pharmaceutical industry is looking for decades all over the world about, you know, what they could learn, what we could learn from, in quote, traditional medicine. And from that, we have gotten opium for a few centuries, curare, and, well, very limited number of products which are efficient.
So you believe local empowerment is not important?
I said yes. I agree with that, but not the second point. I said yes, local empowerment is very efficient. I don't believe that there is any myth of efficient drug or medical practice somewhere in the world that we would not know about. Really, generic is an improvement. And really, if you have tuberculosis or a bacterial disease, you know, antibiotics is better than homeopathic or any plants or whatever. C'est comme ça.
I can't comment on the medical question, but I agree with you on the principle that you elucidated about. As you have stronger global governance, you must, as a corollary, have stronger local empowerment. I think we're seeing it in our own, it's the return to village life, if you like. It becomes very significant in our total human sense. I think that's a very important principle.
Maybe any other comment? Otherwise, maybe we could.
What could we propose? Is there any particular point we could emphasize to help produce some kind of ideas in the field? Because I listen to all of you. What do we do now? I'm perfectly in accordance with my colleague there, especially because you didn't understand, I guess, because what he said about genetics is very important in my opinion, because you can now test this is the pharmacogenetics system. You can test your cytochromes, for instance, and then you can adapt a very regular drug to that specific patient. It's not a case of inventing new orphan drugs. It's not that. If I follow you, it's a very simple system which could rapidly individualize our medical practice, very quick, and for the benefits of all, I guess. You have now this reference in all the medical compounds saying these drugs go through cytochrome, let's say, A3, A34, whatever. This could be a very practical way to try to improve the level, improve the security. And my other question would be, how do we fight the fake drugs and the fake vaccines? Because this is quite a problem. I spent a lot of time in Africa, especially in Senegal, and this is a very important point we didn't mention. And what about the new system of communication, including internet, including Facebook, and so forth? We didn't say a word about that.
Well, maybe you should comment on the testing. Yes, but go on.
Well, we work on personalized medicine, and it's going to be a tremendous difference, but it's not going to change medical practice overnight for a couple of reasons. So one, it's only a few compounds that are going to be accompanied by a respective diagnostic, and it's a many-year process. So it's not that overnight, you can just choose which product works, because there's, again, lots of research behind it. And while we have a couple of diagnostics in our portfolio ready, we don't yet have the compounds ready that actually work against the disease and the biomarker which the diagnostic is detecting. What it will do, in technical terms, it will make the decision of the doctor easier to apply the right medicine. So currently it's a little bit try and error whether a compound works with you, and so it's still a very individual approach to therapeutic treatment decision, and this will be then more mechanistic. You have the genetic makeup, so the precision of the treatment will be higher. But there are all sorts of ethical questions around it which have not been solved. The business model has not been solved, so I don't see it as a process that will revolutionize the medicine overnight. So that's just my...
Yeah, but let's say with these kind of accidents can occur with these drugs, you then take a drug out of the market because it killed some specific genetic patients affected with such bad metabolisms.
I think you agree, because she is saying that she agrees with you, but what is going to happen is not going to happen tomorrow. That's the only thing she's saying. And it's only a few limited diseases.
Yeah, but it could be a political decision to help to go in that way. Because this is what we are looking for, aren't we?
Yes, it could be. I would not say that it doesn't exist. Here again, we are back to government governance, but I mean, this exists. I mean, the point of Petra is definitely right, that it's only on some cases. I mean, as Mr. Cavazou has mentioned, I mean, a lot of drugs have been developed to treat the symptoms, but very rarely the cause. And we are moving into the direction to identify where is the cause and where, I mean, what type of... Yeah. But here, this is where it's widespread. I mean, thanks a lot.
I just wanted to be a little bit practical, because what will we say after this session? What did we say? What do we propose?
Good.
Sort of a practical proposal, but I would say that we need to fly at a higher altitude for the moment. And so I really like the idea of this eminent persons group, or looking at how all of these different constituencies, business, NGOs, the kinds of, Wolfens and the kind of people that you mentioned, and some government officials sort of aligning behind just the concept of getting health on the G20's radar. And then second, I would say that there's a big challenge, and obviously you all are the experts, but how you define health and how you define what the outcomes should be. And I think one very interesting example was Petra's example of malaria drugs, and is it really the pharmaceutical company's problem to ensure employment somewhere, or is your outcome helping the greatest number of patients with the best financial efficiency in the most ethical manner, or is it somehow, are you getting tied up in other issues? And so I think part of defining the outcome is going to be very complicated. But I think at this stage, we're probably at the level of something like, how do you rally the G20 to get it on the agenda before perhaps we get to the level of on specific medical issues, whether it's the one you raised, or herbs in China, or anything more specific.
For herbs, for instance, and Médecins Sans Frontières did some papers on that. We use artemisinin now in Africa. It works. It really works.
But to underscore that point, if it helps, I mean, I think. Okay. But
yes,
to
it is.
Underscore.
We make it available on, and
yeah.
there are some others as well.
It's just mentioning that it's.
So maybe it's possible on a couple of levels. One is to agree at this high level, as Susan said, and I would support, about health should be on the G20 agenda in an integrated fashion. Tick, recommend that. Underneath that, taking your point, without getting into contests and
No,
specifics,
it's not a contest. It's not.
I think what we're hearing today is the importance of the players, the industry, the players actually driving towards an agreement